Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid. And today we're going to be discussing febrile seizures, and of course we're going to go ahead and make it simple. So let's go ahead and get into it. First things first, keeping it very basic. All right, so what is the actual definition of a febrile seizure? And here it is. So it is a seizure occurring in a child 6 months to 6 years of age associated with a fever of greater than or equal to 100.4 degrees Fahrenheit or 38 degrees Celsius in a child without a history of afebrile seizures and that is not caused by a central nervous system infection or inflammation or other metabolic abnormality. Bit of a handful there, but I think the important thing to remember, you have a kiddo, 6 months to 6 years, they have a fever, they have a seizure, and no history of afebrile seizures, so they're not epileptic, for example. And febrile seizures can actually be broken down into two different categories. They can be simple or they can be complex. So I'm going to go ahead and make a little chart to help break these two down. So here's a chart I put together. You've got simple on the left and then you got complex on the right. So what makes a simple febrile seizure? And this is important because the management of these is actually different. So for a simple, it needs to meet three criteria. It needs to be less than 15 minutes with a return to baseline. Okay, and that return to baseline essentially means that they are back to their normal neurologic status. 2, it is primary generalized. So what does that mean? That's full body tonic-clonic seizures. And 3, it does not recur within 24 hours. So it's just a one and done, and there's not multiple back-to-back in 24 hours. Now let's move on to complex. So what is a complex febrile seizure? A complex febrile seizure is any other febrile seizure that does not meet these three criteria. So if it lasts longer than 15 minutes, it's complex. If the seizure-like activity, it starts off with, say, right-sided shaking or motor hyperactivity, all right, then it's not a primary generalized seizure, and now it can be complex. Now, the important thing to remember here, the treatment is a little bit different. A lot of the times for a simple febrile seizure, what do? A lot of the time it's just supportive care. So maybe give a little Tylenol. You can just observe the kid for 2-3 hours, make sure they don't have any seizures, make sure they're, again, at their normal neurologic baseline, and then you send them home. Now, for a complex febrile seizure, this is where you're going to start considering maybe getting a lab workup, and if they're still obviously seizing for a very long time, you're going to want to start looking at administering things like benzodiazepines, Keppra, things like that. So the simple febrile seizure, a lot of the times that's supportive care. If it's complex, this requires more of a workup and medical management. All right, guys, that's all I have for you today. I hope that was helpful. Again, I wanted to make a very quick video just discussing the definition of febrile seizure and then the two different types. Like, comment, subscribe, and as always, if there's other topics you'd like me to cover, please let me know in the comments. All right, thanks for tuning in. I'll see you guys next time.